Hi everyone, my name is John Pedraza and I want to welcome you to the Hartford Ski Spectacular this year, sponsored by Disabled Sports USA. This is going to be an altitude sickness webinar that we're putting on just to help people show up to Ski Spec this year prepared and ready to just have an amazing week and an awesome time, and hopefully nobody with any sickness issues. Just to introduce myself, my name is John Pedraza. I'm an intensive care physician and a commander in the U.S. Navy. I am also a fellow of the Academy of Wilderness Medicine, and I have a diploma in international mountain medicine. And I've done a whole host of outdoor adventure activities and mountain climbing and lots of high altitude experience, including climbing Denali in Alaska and Aconcagua in Argentina. So I certainly know the effects of altitude sickness and how lousy it can make you feel. And so hopefully we're going to prevent that from all of our participants this year. And that's why we put this webinar on. So what we're going to do in this in the next few minutes, we're going to talk a little bit about the causes of altitude sickness, and we're going to talk about some ways that you can hopefully prevent it. And then we're going to talk about how to find out if you think you might have AMS or acute mountain sickness. That's the clinical term for this diagnosis. And then we'll talk about some basic treatment strategies for it if you end up having some issues with it. And just as a historical note, I've been a physician volunteer for DSUSA and Ski Spec for 9 years now. And unfortunately, every year we have people that show up to the medical tent not really prepared to handle the altitude that they're going to be exposed to, and they get sick and they don't always show up for treatment right away, and they didn't really know much about altitude sickness, and then we end up with a pretty significant group of people that end up not having a great time. And we really, really want to prevent that, because we want absolutely everybody, 100% of everyone that shows up, to just have a spectacular time. So anyway, let's talk a little bit about altitude and where we're going on this the Ski Spec adventure and what kind of altitudes we're going to be exposed to. So most of the participants, not everybody, but most of the participants for Ski Spec, they come from sea level, and you're used to living at sea level, and you're used to, you know, boiling water at a certain temperature. It takes a certain amount of time, and you're used to breathing a certain amount of oxygen, and just life is normal and great for you. Well, for Ski Spec, you're going to probably end up on an airplane, and you're going to fly into Denver. And as soon as you get to Denver, you're going to be at 5,000 feet. The Denver Broncos, they call the NFL stadium their Mile High Stadium. You're essentially a mile high from sea level. And already you're going to start to feel some effects from the altitude. You might notice that you're breathing a little bit heavier than normal, especially if you go up and down stairs and stuff like that. But really, 5,000 feet is not that big of a deal. But once we get to Denver, we're then going to board a bunch of buses, and we're going to take a bus ride, and we're going to go to Breckenridge. When we get to Breckenridge and we check in at Beaver Run Resort, you're going to be assigned some sleeping quarters there, and you're going to be automatically sleeping in an environment of around 9,700 feet, or for all intents and purposes, we'll call it 10,000 feet, or almost 2 miles high at that point. And you're definitely going to notice some effects if you just came that day from sea level. And then you're going to get out on the mountain during the week, and you're going to be, you know, riding or boarding or monoskiing, whatever you're doing to enjoy the week and have fun, take your lessons and stuff. And some of you may end up going to some of the highest peaks, and you can take chairs and lifts on at Breck all the way as high as 13,000 feet. And in the local area, there are peaks as high as 14,000 feet. And that's a significant amount of altitude, and especially if you just came the same day from sea level. So let's talk a little bit about what causes altitude sickness. So one of the most important things for our body to function normally is oxygen, okay? And we all breathe oxygen. Normally, it's necessary for all the different mechanisms in our body to work normally, our muscles, our cells, our tissues, everything. And what actually allows us to breathe oxygen normally is air pressure, okay? Air pressure is what actually drives the oxygen into our lungs when we take a breath in and then puts that oxygen into our bloodstream. And when we live at sea level, we're breathing 21% oxygen under a certain amount of pressure, okay? It's we call the barometric pressure, and at sea level, it's 14.7 psi. Think about that similarly to like the pressure that you might put into your tire on your car when you're inflating the tires on the car, okay? So that's the kind of the driving pressure that pushes the oxygen into our lungs and allows us to breathe normally and feel normal at sea level. When we go into the mountains, the actual density of air decreases, or for all intents and purposes, it gets thinner. And when the air gets thinner, the barometric pressure goes down. Well, that means there's less driving force to push that oxygen into the lungs. And so what, in a sense, this creates a lower effective oxygen concentration. That actual air, if you measure the air, it's still 21% oxygen, but because we're breathing it at a lower barometric pressure, we're essentially in a relatively hypoxic environment, okay? So you might start, as I mentioned before, noticing some of these symptoms when you arrive in Denver around 5,000 feet, but most people don't really become susceptible to AMS until they're above 8,000 feet. And definitely by the time you're in the 10 to 12 range, you're definitely susceptible depending on a number of features. So I made a little chart here to kind of show you on our trip this year, kind of what you're going to be exposed to. So again, as I mentioned, sea level, you're at 14.7 psi. Again, think about that like the pressure in the tires, and you're breathing 21% oxygen. Well, as you arrive in Denver at 5,000 feet, the pressure's already down to 12.2 psi. So effectively, you're really only breathing about 17% oxygen. By the time you arrive at Beaver Run, you're at a pressure of 10.2. You're breathing effectively around 14% oxygen. And if you go up to the highest peak during the week at 13,000 feet, you're at a pressure of about 9 psi. You're breathing effectively around 13% oxygen. And how does this all relate? Well, you hear stories about people that climb Everest every year. Everest has an effective oxygen concentration of around 7%. So only a third of the normal amount of oxygen that your body's used to seeing all the time. So what are some of the risk factors for altitude sickness? Well, one is rapid ascent. If you ascend above that 8,000 foot threshold that I talked about rapidly, like more than 1,000 or 2,000 feet a day, that's definitely a significant risk factor for altitude sickness. And then the maximum elevation achieved also has a significant role. So if you want to like guarantee that you get AMS, go from sea level all the way to the highest peak at Breck at 13,000 feet right on the same day, and then ski down, and that's pretty much a guaranteed way to do AMS. So we don't want to do that, right? We want to avoid that completely. Now, the absolute, out of all the risk factors, the biggest risk factor for AMS is a previous history of AMS. If you've been diagnosed with AMS before or altitude sickness before, you are statistically significantly more likely to have AMS again. And every year when I see patients in the medical tent, they come in, and I've had people that have, been to altitude, 15, 16 times, never had any issues, and then one year they show up and they have a little issue and we work our way through it. But patients that come to me 2 or 3 years in a row with AMS, I tell them, hey, you're high risk. We got to take some necessary steps to prevent this next time. Other risk factors that I put out here, if you live at a low altitude, which is most of us, less than 3,000 feet or sea level, landlubbers, as they say, you're definitely at risk when you go to high altitude. And then if you show up and you get engaged in heavy exertion right away, or if you show up and you have a poor fitness level, or you already are a little bit dehydrated, obesity does increase risk as well, in addition to illness, and alcohol through a variety of mechanisms by the way it contributes to dehydration and breathing pattern can also lead to altitude sickness. So those are our risk factors. Those are the things that we want to try to mitigate as best as possible. So how do we prevent it? Well, first and foremost, show up to ski spec physically fit. Make sure that you've been exercising and you're capable and ready to have, a vigorous week of exercise so that you can have fun. The more fit you are, the more fun you're going to have, and the more enjoyment for the week. And that's what we really want. We want everybody to just have an amazing time. The next way to really prevent altitude sickness, as I mentioned before, is take your time getting there. So I know a lot of us, just because of the way the week's scheduled and the travel plans are made and such, a lot of us are going to go from sea level right to Breck on one day. But if you have the time in your schedule and you have the flexibility, consider spending, 1 or 2 nights in Denver first at 5,000 feet and let your body start to acclimate a little bit before you head on out over to Breck. Another really important feature, the first day that you arrive, definitely take it easy that first day, okay? You're gonna feel the effects of the altitude. You're gonna be breathing heavy. I remember, like, every year when I go, as soon as you climb that first flight of stairs, you realize, oh yeah, that's right, we're at altitude, because you're out of breath a lot faster than normal when you're climbing the stairs back at sea level. So that first day, just take it easy. Don't go out on the mountain that first day. Settle into your rooms, drink plenty of fluid, stay hydrated, and just take it easy that first day and that first night before you get out on the mountain the second day. Definitely don't go hitting the high peaks right away. I would suggest, unless you're already living at altitude, or maybe even, in Denver or some of the other higher areas where people are traveling from, those people probably be fine going out and hitting the high peaks right away at the beginning of the week. But for all the sea level dwellers, definitely wait a couple days, 2-3 days into the week before you try to go hitting those really high peaks, because you will notice the altitude effects. And absolutely stay hydrated. Make sure you're drinking plenty of water. At least once a day, your urine should be clear, and that means you're adequately hydrated, and that will definitely help with the effects of altitude. And then certainly avoid alcohol as much as possible, because that will lead to dehydration. It will lead to hangover, it will lead to headache, and it will just exacerbate all the other effects that altitude has on your body. And then last but not least, and I hope this doesn't happen to anyone that's coming to Ski Spec this year, but if you happen to get sick with a serious illness, especially the flu, right before Ski Spec, don't come. And, I hate to say that, because I want everybody to come and I want everybody to have an amazing trip. But unfortunately, every year, people show up and they're like, oh yeah, 2 days before I started to get fevers and sweats and chills and, runny nose and blah, blah, blah. And then they show up at altitude and it is significantly worse. And then at that point, they get diagnosed with the flu, and then they end up having to get sent home, because you can't recover as easily at altitude when you're used to living at sea level. So try your best to stay as healthy as you can and not get sick before the trip, as easy as that sounds, right? All right, so those of you that have a prior history, so maybe you've come to Ski Spec in years past, or you've done some mountain climbing, or maybe some camping out in the wilderness at altitude or something like that, and you have been diagnosed with AMS, or you recognize that you probably did have it, you're at the highest risk, right? So what do we need to do for you? We still want you to come to Ski Spec. We want you to have a great time, but we want you to take the necessary steps to make sure that you enjoy yourself right from day one, and you don't succumb to AMS and don't have your entire week ruined, right? So if you have a higher previous history, you're at the highest risk. So it's very likely you will get AMS again when you get to Breckenridge, okay? So what do you need to do? You need to acclimatize. You need to go to Denver a day or two before, hang out in Denver, sleep in Denver, get your body readjusted to the altitude before showing up at Breck, and that will go a long way towards helping your body adjust to that altitude, okay? And another thing that you should definitely consider, and I strongly recommend, is go talk to your personal physician and consider getting a prescription for oxygen, okay? There are several vendors in the local Breckenridge area that provide oxygen concentrators, and they will get you set up with some oxygen. And so you don't have to necessarily bring it with you from home, but you can get a prescription ahead of time, get set up with one of those venter so you can get some oxygen. So at the very least, you can be using oxygen when you arrive at altitude, or be sleeping on oxygen at night, and that will go a long way towards helping you with those symptoms of AMS. And then another consideration, again, talk to your personal physician about this, but a prophylactic prescription for Diamox. That's a medication that helps prevent AMS. You'd want to start taking that about 24 hours before coming to altitude. The dose is 125 milligrams. It's taken by mouth twice a day. It does have some mild side effects. It can make your lips feel tingly and your fingertips feel tingly, and it can change the way some of the foods taste, especially sodas. But it's otherwise generally well tolerated, and it is very good way to help prevent AMS. And we use that in the military all the time when we have soldiers that have to go to altitude rapidly, and they don't have the way to acclimatize normally, and it can go a long way towards making your trip a lot more comfortable. But again, talk to your personal physician about the risks and the benefits of that before you decide to go down that route. All right, so let's move on. So how do you know if you have AMS or not? Well, first and foremost, to make the diagnosis, you have to have a headache. So it's a headache plus a bunch of other stuff. And doctors, we use this thing called the Lake Louise score. And it's a scoring system. Basically, we ask you all the different symptoms that you're having, and then we score you on this little score sheet. And if you score above a certain number, then you're most likely to have AMS. So how do we make the diagnosis? It's you came to altitude, you developed a headache, and then you got a bunch of other stuff. And those things could be things like unexplained tiredness. Now, if you just climbed a mountain, you're going to be tired, right? But if you just drove on a bus and an airplane and you didn't actually do anything, but you're just completely exhausted and you have no energy whatsoever, plus that headache, then you probably have AMS. Unexplained weakness, same kind of thing. Certainly any nausea or vomiting, loss of appetite, loss of interest, just general apathy, like you don't want to hang out with your friends, you don't want to talk to anybody, you just want to be left alone, you got this terrible headache and your nausea, probably got AMS. Lightheaded, dizzy, and then certainly can't sleep, and that's very common, the inability to sleep with the headache. So any of those symptoms plus that headache, you probably have AMS, and at that point you should come to the medical tent and get evaluated. The sooner you get treatment, the sooner you get feeling better, the more time you have to enjoy the rest of the week at ski spec, okay? Keep in mind that these symptoms, they can go on for like 3 or more days. So if you wait and to go talk to anybody about what's going on until day 2 or day 3, you've already been feeling miserable for 2 or 3 days, and then we start treatment, it's going to take another day or two for you to start feeling better. By then the week's over and you've kind of lost out on a great opportunity. So don't wait, get on it right away. And just know that like the symptoms of AMS at Breck, when we're only around roughly 10,000 feet, they're not that bad, but AMS can become very serious and it can lead to very life-threatening conditions. There's high altitude cerebral edema, high altitude pulmonary edema. We usually don't see those things at the elevation of Breck, but they can develop, especially if you have some pre-existing conditions. So definitely be aware of that, and definitely seek out treatment early if you think that you're starting to have some signs of those things. All right, how do we treat it? How do we make you feel better? Well, first and foremost, rest, okay? So if you've got a headache and you're nauseous, the very first thing we're gonna tell you is, hey, you need to stop, take it easy. And every year this happens where somebody, they're really excited to come to ski spec, so they get hooked up with an instructor, they go out on the hill for the first afternoon, and then by that first afternoon, they have a headache, right? Usually the symptoms of AMS, they can start as early as 3 hours at arrival to altitude, but the average person usually starts anywhere between like 6 and 12 hours after arrival. So if you don't show up till the evening before, then you're just resting and you're sleeping, you may not really start to get the symptoms until you've started some physical exertion, which is after that first lesson in the morning. So we're gonna tell you right away, hey, you need to rest, you need to knock off. Don't do an afternoon lesson, go back to your room, chill out, relax, drink some water, that kind of stuff. Don't go back out on the hill, because that's just going to make it even worse. And unfortunately, every year we have a couple people that try to sneak out there and do that despite medical advice, and then we really can't help you, because you're not really following the recommendations for treatment to get better. Motrin, Motrin's a huge benefit with this disease process because, again, everybody presents with headache. So I recommend actually everybody that comes to ski spec, regardless of your risk factors or your history, you bring an adequate supply of Tylenol or Motrin just for your general aches and pains, and if you end up having a headache, because you can self-treat with that, and that's great. But if you end up with AMS, one of the treatments is going to be Motrin. We'll usually use 600 or 800 milligrams. You're going to take it 3 times a day, around the clock initially for the first 24 hours, along with some rest and some hydration, and then we'll reevaluate how things are going. For those of you that are more seriously affected, you may end up requiring oxygen, and we usually have oxygen concentrators available, and we'll get you started on some oxygen therapy initially. Usually everyone ends up with it. Those of you that require oxygen, like your symptoms are severe enough to require that, you're probably going to be on it for the rest of that day and the night before you get reevaluated to see if you can even come off. So that's one consideration. And then again, as I mentioned, Diamox, or also called acetazolamide, we use that for prevention of AMS, but it's also used in a treatment at a higher dose. That's another consideration. And then lastly, and we hope to never do this, but every year we do end up having to do this for those with severe symptoms, is we end up having to send you back to a lower altitude, sometimes just to Denver, and other times all the way back home at sea level to get the symptoms to go away. So we really want to prevent that. We really don't want to see that happen to anybody. We want everyone that shows up has a great time, but that's a little bit of information about AMS, about the treatment and whatnot. So to conclude, DSUSA staff, they put a tremendous amount of work into this event every year, and they want everybody to show up and just have an amazing time, right? And the reason why we're putting on this webinar is just an awareness, really. We want everyone to know, hey, altitude, it can make you sick and it can really ruin your trip, and you need to be aware of it in order to prevent it, right? So we talk about some prevention strategies, and if you start planning now, you got a couple weeks to go, and you can really head things off and show up and just have an amazing week. Unfortunately, if you do show up and you start having altitude sickness, it's a bummer, but come seek treatment right away. Come see me or one of the other docs or medical providers at the medical tent, and we will get you squared away. We'll get you on a good treatment plan. We'll get you feeling better, so that at least we can try to salvage some time and you can still enjoy yourself. All right, so I'm Dr. John Pedraza here, just finishing up altitude sickness webinar for the Hartford Ski Spectacular and Disabled Sports USA. And thank you all for listening in, and I can't wait to meet you at Ski Spec this year, and I'm hoping everyone has an awesome time. Bye for now.